So we want to start this afternoon by going through the part 2, the employee events. This is where we have our quiz. All right, so I'm actually going to walk through specific examples and what those actual codes would be when you're doing line 14 and 16. So we're going to walk through a bunch of them. We're going to have an opportunity for you to kind of do them on yourself or for yourself as well. I made some assumptions specific to the examples that we're going to run through here. For the examples that we're running, everybody's offering a minimal essential coverage and value plan. So it meets the MAC requirement, meets the minimal value requirement. If you end up doing something different, obviously it would change the coding you're using. We've also assumed that you're offering benefits to employees and dependent children. I know we've got the exception that we're not offering to spouses, so instead of 1E, you end up using, I think it's 1C or something, the code you'd use if you don't offer to spouses. We did use a calendar year plan. You know, the IRS is getting everything aligned that way. I would hate that because all renewals will be the same time each year, but we're just going to do that for consistency purposes. And we also assume that we're under a monthly measurement period for each month. There are some examples that we will bring up look back, so we will talk about look back, which is going to help tremendously as well. But if it doesn't say that, it is monthly measurement. So let's start with the ongoing employees. So this is our normal ongoing employees. This is going to be the bulk of the folks that you have at your employer right now. So example 1, we have an ongoing full-time employee. They're offered and enroll in coverage for the entire calendar year. Employer utilizes the W-2 affordability safe harbor for all of its employees. So what are the codes I'm using for that? Well, you'll see that I'm going to choose my 1 series code, and in your booklet you're going to have all the codes, or in your folder you'll have all the codes. If you don't have that out already, grab that. It's front and back. It's your 1 series codes, and on the back it'll be all your 2 series codes in the folder. So the 1 series code we're going to use is 1E. So I made the offer to the employee the entire year, and it was minimal essential value and coverage offered to the employee, spouse, and children. And then on line 16, I'm going to go 2C. So 2C you'll see on the back says basically they were enrolled in coverage, and they were enrolled in coverage every month of the year. Now, another code that actually would work there is this next one. So I have an ongoing full-time employee, offered coverage for the entire calendar year but declines. So they don't take the coverage, even though they're a full-time employee for the year. Employer utilizes the federal poverty line affordability safe harbor for all of its employees. Now remember, if I'm offering the safe harbor code, I know it's affordable, regardless of how much the employee makes. That's how I can use that code 1A. So I use 1A as my offer. The employee did not enroll in coverage. So now what I want to do is I want to show that I offered coverage. I used an affordability safe harbor. If you look at 2G, that's going to say that's based on the affordability safe harbor. That's the code specific to that one. So it shows I offered coverage.
You actually first.
Yep.
I'm just trying to write down 2C.
I'll show you. So 2C, this is what Caroline talked about. 2C trumps everything else. Because in fact, I use the W-2 affordability safe harbor. When you look at your 2s, affordability, W-2 affordability is 2F. So I could have said I can use 2F here. I offer them coverage, they enroll. I use the affordability safe harbor for them. But
They're declined because they're on another plan.
oh no, we're not in the quiz yet. Yeah, just watch this. Yeah,
Okay.
I'll let you know when we're doing the quiz.
They're already.
Yeah. So I could, on this one though, I could have used 2G because I used the affordability safe harbor. Oh no, that's not 2G. That's affordability is. Which one's affordability? 2H. Sorry. So I could have used 2H. I went to G. That was G. Affordability. What am I looking at? Oh, right.
Yeah.
It's late in the travel for days. So I could have used 2G at the bottom. I was right the first time. I could have used 2G but because they were covered, 2C says they were covered, 2C always trumps the other one. Remember, that's the best of the right answers. So I used 2C, and 1E was the offer of coverage every month. 2, I know it was affordable, I made the offer to the employee did not take it. What was the safe harbor I used? 2G was the poverty line affordability. So it was affordable every month, and because I made the offer and it was affordable, I'm not gonna pay a penalty, even though the employee's not on my plan. That makes sense to everybody?
But this time you wouldn't receive because the person declined.
So example 3, I have an ongoing full-time employee. They're offered coverage for the entire calendar year, but they decline coverage. The employer does not utilize an affordability safe harbor. So I can't use one of the 2 series codes based on affordability safe harbor. So in essence, I leave it blank. When we talk about this, what does that mean? It means I've exposed myself to risk. I'm not using one of the codes that helps protect me because I actually haven't used an affordability safe harbor. So in essence, what's going to happen here, if when I file this form, the IRS is going to get this and they're going to say, we offer coverage, we don't know if it's affordable to that employee, so then they're going to look at the employee's modified adjusted gross income for the family, and whatever we charge, we're going to put in line 15 how much we charge that employee for the insurance. They'll check that against their family income and see was it less or more than 9.56% of that family's modified adjusted gross income. So without using an affordability safe harbor, we have no clue if we're going to pay a penalty or not. It'll all get shaken out at the end of the day if the IRS manages all this. So kind of drives home. In essence, I don't have to choose affordability safe harbor, but it certainly helps me to identify which ones I think I'm at risk for, which ones I know I'm probably not at risk for. So I just leave that blank. I cannot leave line 14 blank. None of those boxes can be blank for line 14. They can be for 16. All right, now pop quiz number 1. So why don't you take a few minutes, see if you can answer this. We have an ongoing full-time employee. They're offered coverage for the entire calendar year, but they decline because he's already covered under the plan as a spouse of another employee. The employer utilizes the federal poverty line affordability safe harbor for all its employees. It would take a few minutes, use the codes, see if you can fill this out. I think what you'll see, a lot of these examples are ones that you'll absolutely have within your employment. You'll have employees filling these, so hopefully we'll get out of here knowing 98% of the answers. So what you'll see here is the offer was made. It was under the affordability safe harbor, so I'm allowed to use 1A. There is a challenge here, and there's multiple challenges. I've said this, we're gonna have clarity on the codes as we go forward. In essence, 2G would say it's they decline because of the federal poverty level. The challenge is because my spouse is on the same plan. I'm actually on the active employer's plan. I'm participating in it, just under my spouse, not under myself specifically. IRS has addressed that. So this is one of the questions we have into them as a Q&A, because 2C trumps 2G. So are we wrong if we put 2C, they're covered under the plan, they're just not covered on the plan under their own, they're under their spouse on the same employer. So that's where it's not necessarily a trick question, but there is some ambiguity here from the IRS that we don't know specifically which one we're supposed to use here. So there are some trick questions in this. So let's move on to new employees. So instead of ongoing, we're going to hire new employees, and how would that be managed? So I have a new full-time employee hired on August 1st. The employer uses the monthly measurement method for tracking employees. The plan has a 1-month waiting period. Employee is offered and enrolls in coverage effective September 1st to the end of the year. The employer utilizes the rate of pay affordability safe harbor. So remember, even though they weren't my employee, they're full-time for a month, I've got to complete a 1095-C for them, and I've got to complete all months of it. So what I actually have here is I've got a 1H through August. It says that I did not offer benefits to that employee January through August. Even though I hired him in August during the waiting period, so I didn't offer benefits. Then when I did actually offer benefits, I switched it over to the 1E from September through the end of the year. Now for my 2 series codes, if I avoid having to pay penalties, I'm going to say 2A, January through July, which says they were not an employee of mine, they weren't employed during the month, January through July. So obviously I can't penalize me if they're not an employee and didn't offer benefits. Now you will see, look at August. So they were a full-time employee in August. I didn't offer them benefits because they're in their waiting period. I don't want to have to pay a penalty if I didn't offer benefits because of the waiting period. That's where I get to use that 2D, which is the limited non-assessment code. That's why that's so important. Get me out of jail. I didn't offer benefits. You can't penalize me for that. Even if they have a premium subsidy, you can't penalize me. And because I use 2D here, I don't count that individual as a full-time employee for August when I do my belly button count on the 1094. Remember column B, how many full-time employees for the month? If I use 2D here, that's not a full-time employee. So again, you can't penalize me. You can't use that in the equation if I offer benefits to 95% of my employees because I use 2D. And then I switched to 2C from September through December. They were covered on the plan. They elected benefits and were covered on the plan.
It says no office coverage.
Which one are you on?
Once again,
So does that make sense to everybody? So obviously, depending on when my employee comes on, how long my waiting period is, I'm just going to take these codes and apply it for that specific situation.
I just have a quick question. Let's say they're hired like on the 10th,
Yep.
but we still make them wait to the following month to take the insurance. Is it still the same?
In that situation, it ended up being the same.
Okay.
We didn't offer benefits to them when they were hired mid-month because of the waiting period. Then they're eligible the first month following. Same thing. I'll have to make a determination. Did I offer benefits or not? And then use that appropriate code. 2D, they're in the waiting period. You can't penalize me. Yep. 2D will be your friend. Example 5. A new full-time employee is hired on August 1st. Employer uses the look-back measurement method for tracking employees. The plan has a 1-month waiting period. Employee is offered and enrolls in coverage effective September 1st to the end of the year. Employer utilizes the rate of pay affordability safe harbor. Nothing's different. This is kind of a trick question. It's a new full-time employee, and I use the look-back method. For my new full-time employees, look-back doesn't matter to them. So I treat them the same as any other full-time employee. So really, it's kind of redundant here from the question we just had, but you'll see as we go forward, there are some situations where full-time status and look-back will make differences, and here it does not. So don't get nervous if I have a look-back and I hire a new employee. When I hire a new employee right off the street as a full-time, treat them as a full-time employee. I hired a new variable hour employee is hired on August 1st. Employer uses the monthly measurement method for tracking. Plan has a 1-month waiting period. No offer of coverage is made to the employee during the year. So I never offer the coverage to the employee. The employee's hours of service exceed 130 for October, November, and December. So when they're not an employee, I did not make an offer of coverage. Now, in fact, I never made an offer of coverage. This may pertain to a bunch of you here. When you go back and do your filing for 2015, I got variable hour employees, non-full-timers. I never made an offer to the entire year, so I'm using 1H all across the board. Now, the protection potentially or the risk is going to be on the bottom. Well, when they're not an employee, they're not an employee, so I'm going to put 2A. When they come on in August, when they come on in August, I'm going to use 2B. Employee is not a full-time employee. It's a part-time employee. The months they were part-time, I'm able to use 2B. They were full-time for 3 months, October, November, December, but I didn't make an offer of benefits to them. So what have I done? I've left myself up for risk there, just like we talked about. I have a variable hour employee, a non-full-time employee. Any month they work full-time, if they have a premium subsidy in the marketplace, I'm at risk for paying a penalty. So now the IRS will adjudicate this. They'll grab the Social Security number. They'll look at that individual Social Security number. Did they pay out a premium subsidy for those 3 months or any of those months for them? If so, we're getting dinged that $260 each month. They paid a premium subsidy.
What if the employee just wasn't covered?
No premium subsidy, no penalty due.
So long as they didn't go to the marketplace, we're fine.
You're okay. So, and that's a great question. If they're not in the marketplace receiving a premium subsidy, you're not gonna pay a penalty on that individual. That's excellent. This year's probably the best scenario. If you're familiar with the individual mandate, 2014 is when they were first penalized. They filed their taxes this year for in 2015, they filed for 2014. The tax penalty was very minimal. They kind of wanted to bridge their way into this $95 or greater of 1.5% of a threshold amount. That's going to continue to go up. The fine amount is 400% more this year than it was last year, and it's going to more than double next year. So for you all, this is the best scenario for 2015 you could ask for. A lot of folks don't even know they were supposed to have insurance, or the fine was so minimal they didn't even understand what it meant when they filed their taxes last year, so they probably didn't jump in and get insurance this year. As soon as they get the penalty this year, I have a family of 4, it's starting to get expensive. I'm looking about $1,600. That's going to get them to wake up and try to turn, all right, I got to figure out 2 things. From a financial standpoint, what it means for you and what it means for your budgets. You've got folks that are full-time that you've offered benefits to and they've waived off. They've determined it's not affordable. It may be affordable under ACA rules. Hey, it's $90 a month, but to somebody making $8 an hour, that's not affordable. I'm not taking insurance. I go without. Hey, I go to the hospital, they write it off anyways. As they start paying these penalties and as those penalties escalate, they're going to decide, I need to go get insurance. I don't want to pay these penalties anymore. Where's the only place I can go to get a subsidy? They're going to you all. They're going to the employer plan. So from a budget standpoint, understand that your cost for healthcare is probably going to increase year over year as we go forward. I've got some employers, we've got a survey tool. You may want to survey your full-time employees that waive off your plan. Just ask them, do you have coverage elsewhere? Are you uninsured? Look at that population of uninsureds. Just know, more than likely, next 3 years or so, it's more expensive for them to not be on our plan than be on our plan. So we've got a budget for that, even if we've got to reserve some dollars or whatever, especially if you're a county, city, or school. So just understand that risk is potentially coming down. And this year, obviously, a lot of them aren't on it. So as we go forward to the next year, that's where we want to make sure we're likely they're going to have more people in the exchange if we don't offer coverage.
An extreme specific question to my situation. Does Amish aid, would that be considered insurance?
I think that's one of the true exceptions. You remember, Caroline? I think it is.
So long as they are part of an Amish aid plan, then they don't have.
I don't know how you report that out.
I would want to verify, there are certain, it's American Indians, that there's a couple very specific exclusions that don't have to comply with ACA, and I believe that's one of them. That's back from like 2-3 years ago. I haven't looked at that recently though, so it's scary if I remember that. Yeah. I know we can get that answer, I just don't have it. Yeah, get stumped. All right, pop quiz number 2. So this one here, we have a new variable hour employee hired August 1st. The employer uses the look-back measurement method for tracking employees with a 12-month initial measurement period. The plan has a 1-month waiting period. No offer of coverage is made to the employee during the year. The employee's hours of service exceed 130 hours, October, November, and December. So it's a new variable hour employee using look-back. See if you can figure that out. There's the answer. So this kind of goes to, there is some logic with this, and there's some logic not in here, unfortunately. So what the IRS says is, during your initial measurement period, we're trying to determine if you're a full or part-time employee. So during your initial measurement period, you are considered a full-time employee. If you are not, part-time employee. If you are not a full-time employee at least 1 month of the year, you don't report on it. So they weren't an employee January through July. They were in their initial measurement period, August through December. Doesn't matter how many hours they worked. They were considered a part-time employee or non-employee the entire year, so I don't report on it. Now, if it ends up being that my initial measurement period splits a year, so that 12 months ends in May or something, and then I've got to make a determination at that point, then I may actually report. But in this situation here, I don't report on that person. This is one of those tricky areas. Kind of where I'm going with this, guys, is when you're making decisions, who's going to do my IRS filing, check the vendor solution. A lot of the vendor solutions are telling you, your payroll and your finance companies are telling you, yes, we can do IRS reporting. Most of what they're offering is the actual transfer to your employees into the IRS, and that's all they're doing. They're not providing the consulting to figure out what are the actual codes, how do I strategize, what am I going to put in the information. I think that's probably far more important than the actual transfer of this itself. So, trick question, very difficult to understand this. Reading through this, and I didn't give you the actual instructions. Caroline has it, I think it's 14 or 16 pages long, front and back, and that is even everything. So, anytime we've had subsequent questions or follow-ups, and we've got several in the IRS now, they release these little FAQs after, so it's not even part of it. They just say, hey, based on this question, these are the codes you need to use. So a lot of what we're sharing with you is based on a lot of that FAQ stuff that you probably didn't know goes around. So like I said, I apologize for that. All right, now let's talk about termination of coverage. So I've got employees terminating. So I have an ongoing full-time employee enrolled in employer coverage start of the year, has his employment coverage terminated immediately following May 31st. Employee elects and maintains COBRA coverage for the remaining months of the year. The employer uses the W-2 affordability safe harbor. So I'm going to use 1E when they're a full-time employee and the offer of coverage was made. Through May, coverage ended at the end of the month. Now here's where it kind of seems weird for you. So they terminate and I offer COBRA to that employee. But the answer says 1H, I made no offer of coverage. There's a specific COBRA requirement. If the employee is terminating, I use a 1H. It's basically like no offer of coverage is made. This is a rule you just kind of have to memorize. It doesn't make sense. If they terminate and I offer COBRA, I say that I never made an offer of coverage. So just understand if that's the situation, I use 1H. Down below, 2C, the months they were covered. When they went out of COBRA, they're not an employee for the month, so I just report that. Doesn't matter if they took COBRA or not. So this is just something you're just going to have to memorize when it comes to COBRA. Now let's look at the next scenario. I have an ongoing full-time employee enrolled in employer coverage at the start of the year, but has his coverage terminated immediately following May 31st due to their transition to part-time status. The employee declines COBRA coverage, the employer utilizes the W-2 affordability safe harbor. So now you'll see here, I actually continue to use 1E. I offered COBRA, and now I actually say, and the reason that the difference here, they're still an employee. So the COBRA event was them moving to part-time status. I don't use 1H if they're terminated. I continue to use 1E or 1A or whatever it is that you use on the top end. I'll use that every month because they're still an employee. You just have to memorize it. Doesn't make sense. You read through these codes, you're not going to find it. Down below, same thing, 2C for the months they were covered. 2B, not a full-time employee, the months they were moved to transition to part-time. Example 9, I have an ongoing full-time employee enrolled in employer coverage at the start of the year, has his employment coverage terminated on May 15th. So the coverage ends on mid-month. Before accumulating 130 hours of service for the month, doesn't matter, coverage ended on the 15th. The employee declines COBRA coverage, the employer uses W-2 affordability safe harbor. So what you're going to see, same thing. I offered coverage through April. Why did I use 1A or 1E for May? Because they didn't work the entire month. They didn't have coverage the entire month. If they don't have coverage for one day of the month, I cannot use that 1A or 1E. I have to use 1H. Coverage not offered for the month because they weren't there the entire month. So I'll use that for the rest of those months. Now, to protect myself, they were covered through April. I use 2C. 2B, you'll see 2B, it says employee not full-time for the entire month. So that's where I use 2B. So they weren't offered coverage because they weren't an employee the entire month. And then 2A, they weren't a full-time employee June through December. So I've got these partial months. You know, basically, I think at the end of the day, I want to be a calendar month, and I want all my coverages to end and start on the first and last day of the month. If not, it obviously is just going to be more reporting requirements and a little more confusion on your end. Any questions on this one? Get there? And remember, this PDF, if you want to get it, Lindsay, Brooke, MedBen, they'll have access to it. Just get in touch with them and can send it out to you after. So that may help you if you want to go back through and kind of spend more time looking at this and get more confusion. Example 10, ongoing full-time employees enrolled in employer coverage at the start of the year, ongoing full-time, has the employment terminated on May 15th before accumulating 130 hours of service for the month, but his coverage extends to the end of the month. Employee declines coverage, and employer uses W-2 affordability. So just the opposite, because the coverage doesn't terminate when they terminate, then I get to carry through the offer of coverage through the end of the month, May. They were covered through May on their benefit. So literally it's just one or the other depending on when that coverage ends. An ongoing full-time employee enrolled in employer coverage at the start of the year has his employment coverage terminated May 25th after accumulating 130 hours of service for the month. Employee declines cover, the employer uses a W-2 affordability safe harbor. Looks the same. Doesn't matter what day they terminate, the coverage ends prior to the end of the month, and it doesn't extend to the end of the month. Doesn't matter how many hours they work that month, just to make sure that I report it correctly. They weren't a full-time employee in May. All right, pop quiz number 3. I have an ongoing full-time employee is enrolled in employer coverage at the start of the year, has his coverage terminated May 21st after working 130 hours for the month due to his transition to part-time status. The employee declines coverage, the employer uses no affordability safe harbor. So he's got lots of stuff going on here. I actually think our answer is incorrect. I'm going to check with our attorney on that. So 1E is the offer of coverage. We're not using affordability safe harbor, so I don't know if it's affordable or not. That means I can't use 1A. That means I know it was affordable. So I use 1E as the offer of coverage. Remember with COBRA, if I terminate, if I lose coverage, I'm offered COBRA, but I stay employed, so I just moved to part-time, I continue to use 1E. That's that COBRA rule. So I use 1E all years. Now 2C when they had coverage, I actually believe that this is 2B. I've got to check with him because it's a partial year. He's used it as, and what he's got here is he's saying that we didn't use an affordability safe harbor, so we don't know if it's affordable or not. But I think 2B is going to trump that, so that'll be one I have to follow with y'all on. I'm not quite sure what that is.
So I was thinking one of your examples, we weren't going to use affordability safe harbor, so we had to leave it blank.
Underneath, right, that's a different scenario. This one here is because the coverage terminated mid-month, so that's where the question is which one do we use?
The 2B is one of those that has multiple uses for that code.
Yeah, there's like 3 different ways you can use 2B. So I've got to check on this. I'm not sure that that's actually correct. And sometimes you got to keep those attorneys in check. Yeah. All right, let's now talk about transitions in employment status. So example number 12, we have an ongoing full-time employee is enrolled in employer coverage at the start of the year, has his or her hours reduced to less than 30 beginning June 1st. Since the employer utilizes the look-back measurement period with January through December stability period, no changes made to the employee's offer of enrollment and coverage. The employer utilizes the W-2 affordability safe harbor. So the employee was full-time and moved to part-time on June 1st, but their changed, their benefits and their eligibility did not change, so they stayed on the benefits that entire year. Why is this? This is an ongoing full-time employee, we're using look back. So what does look back mean? I don't apply, this is one of the misconceptions, I'm only using look back for my variable hour employees. It doesn't work that way. I'm using look back for all my employees, including my full-timers. So my measurement period is actually tracking all my employees across the board, part-time and full-time. It's mostly used for your variable hour employees, but in situations like this, I've got to apply it to my full-timers as well. So ongoing, this employee worked full-time last year as an example. So I worked full-time during the measurement period. I'm full-time the entire stability period regardless of my change in hours. So I moved from full-time to part-time, I'm still a full-time employee that entire stability period. So if I use look back, I have to understand how do I apply this from the get-go, from the front and the back end. In this situation here, I moved to part-time status, I'm still a full-time employee. They may actually qualify again, depending on how long they were full-time during the measurement period. So they might be full-time for even the next stability period. So just understand that when you have these transitions with a look back. Make sense? Anybody have questions on that? This may be brand new for some of you that don't typically have that. I never thought about that. Example 13, ongoing full-time employees enrolled in employer coverage at the start of the year but has the hours reduced to less than 30 beginning June 1st. Since the employer utilizes the monthly measurement period, employee status is changed to part-time. He's no longer eligible to participate in the plan. Employee is offered COBRA coverage but declines. The employer uses W-2 affordability, safe harbor. So because they moved to part-time, I continue to use 1E for that COBRA offer. 2C and 2B, because I'm using monthly measurement. So it's just the difference between look back and monthly measurement determines what I actually put in here as my answers. An ongoing part-time employee is not eligible or enrolled in employer coverage at the start of the year. Employees' hours of service are increased to more than 30, so they move from part-time to full-time June 1st. Since the employer utilizes the look-back measurement period with January through December as a stability period, no changes made to the employee's eligibility and enrollment in the plan. The employer uses W-2 affordability. So what happened here? I'm using look-back. I've got an ongoing part-time employee. They qualified as part-time during the measurement period, so during the stability period, they're part-time the entire year, even if I move to part-time or full-time during the stability period. I am a part-time employee that entire stability period. So because I'm a part-time employee the entire 12 months, I don't report for that employee that's part-time the entire 12 months. So you kind of got it coming and going. I moved from full-time to part-time, I'm using look-back. I probably got to continue to offer benefits to that employee when they're part-time. I'm using look-back to move from part-time to full-time. I'm not going to be offering benefits to that employee when they move to part, or when they move from part-time to full-time. That makes sense? That one's probably new for you as well. It's kind of confusing. Just understand, if I apply look-back, it's across the board. It's for everybody. It's not for a select group of employees. I qualify the measurement period, and I remain in that qualified status the entire stability period. Either full-time or either part-time. For every month, regardless of the number of hours I work, the next stability period will be determined by that next measurement period. So this goes for the 1095C. It also goes for the 1094C. If I'm part-time the entire year, I never count your belly button on column B in the 1094C as a full-time employee. All right? Pop quiz number 4. An ongoing part-time employee is not eligible or enrolled in employer coverage at the start of the year. The employee's hours of service are increased to more than 30 beginning June 1st, so they become a full-time employee June 1st. Since the employer utilizes the monthly measurement period, the employee gains eligibility, enrolls in the plan following a 1 month waiting period. The employer utilizes the rate of pay affordability safe harbor. This is one that we've had at almost every group get right. Setting that bar high for you. Somebody used 1H for the months they were part-time and I didn't offer coverage to them. July is when they became eligible as a full-time employee. So I do 1E through the end of the year because they're using the rate of pay affordability safe harbor. I can't use 1A unless it was a poverty line. So I use rate of pay affordability. Now, 2B, not a full-time employee through May. June, they become a full-time employee, but I have a 1-month waiting period, so I use 2D, limited non-assessment. It's my code for part-time, or for full-time waiting period. Then they were covered July through December, so 2C is not on there. Get your gift. Participate. That makes sense? Any questions on this one? All right, now let's move on to COBRA and retiree coverage. So these are our non-employees. So we have a former full-time employee enrolled in retiree coverage throughout the calendar year. So this is somebody retired, 2, 3, 4 years ago. They're enrolled into coverage, and we're required to report on them and give them a copy of the 1095C. You're on a self-funded insured plan, you don't use an affordability safe harbor. It really doesn't matter here. In essence, I'm going to use 1G the entire year. It just says they're not an employee, they weren't full-time for any month of the calendar year. Use 1G across the board. I don't have to worry about 2G because they're not an employee. So for all your retirees for the entire calendar year. Really easy to do. Pop quiz number 5. Quiz came quicker that time. Need more breathing room. An ongoing full-time employee is enrolled in family coverage, which covers her spouse, and her minor dependents. On May 31st, the employee dies. The employee's spouse and minor dependent elects COBRA coverage effective June 1st and maintains such coverage to the end of the year. The employer-sponsored self-insured health plan uses no affordability safe harbor. Only difference is the 1I or 1H would be no offer of coverage. Because they're not an employee, so I use no offer of coverage. But all your others, 2C, 2A, and 1E are correct. But, we will have this, I know, hopefully not very often, but we're going to have this in your employment, and we'll have some folks pass away, you'll have to do the COBRA offer for them. Now, one thing that you may want to consider as well, and I try to advise administrators on this as well, is one thing you may want to do is when you have an employee event that becomes COBRA eligible, especially termination or whatever, or part-time status, make sure they understand they may have a subsidy opportunity in the marketplace. The difference for that employee is they're paying 100% of the premium now for COBRA, or due to income changes that may be eligible now for premium subsidy in the marketplace, which might be extremely more cost-effective for me. I think a lot of folks will not continue to pay for COBRA once they get a premium subsidy, they can qualify for it. Something you may want to share. Now we've gone through this, but there's a lot of considerations as you move forward. Beyond some of the gray areas, beyond just having to learn some of these rules, it may not make sense, it just is what it is. There are things that are kind of nuances that we're not sure what those answers are, because they haven't quantified that or given us the information and instructions. What happens through the event of a divorce, deceased employee in the middle of the year? There's not a clear answer for the codes. When you're transitioning mid-year to retiree coverage, we think we know those answers, but again, it's not addressed specifically, so they haven't told us this is the exact codes that you end up using. The unpaid leave of absence, we talked about that earlier. There's a lot of confusion, unknowns around that, how that's coded and not coded. Your non-calendar plan years, there's still some ambiguity there too. So we're still waiting on a lot of answers. I think, again, there will be additional codes we're going to have to learn next year and years beyond for scenarios that they didn't think about, that you all are going to help uncover.